The issue we will be covering is nurse-to-nurse handoff or nurse-to-nurse report, specifically from one shift to the next. New nurses sometimes struggle with providing a quick and thorough report. Friesen et al. Has come up with multiple definitions of nurse handoff or shift-to-shift report. These include the transfer of essential information and the responsibility for care of the patient from one healthcare provider to another is an integral component of communication in healthcare. Secondly, is the transfer of information along with the authority and responsibility during transitions in care across a continuum, to include an opportunity to ask questions, clarify, and confirm. It is also a mechanism for transferring information, primary responsibility, and authority from one or a set of caregivers to oncoming staff. Karna's entry to practice competencies state that a good report fulfills some of the requirements under the heading Service to the Public. Those include, it is necessary in facilitating continuity of client care, as well as doing a proper report uses established communication policies and protocols within and across healthcare agencies and with other service sectors.
Hi, I'm your Karna representative. I will be taking you through the do's and don'ts of nurse-to-nurse end of shift report. Join me in watching the brand new RN in her natural habitat, communicating with the nurses of her pack.
It's 7 o'clock in the morning, and you have worked what was the longest night shift in the history of mankind. You are pretty sure the clock stopped for a few hours in the middle, dragging out the night for what felt like 30 hours. Yet somehow you still haven't managed to finish your charting in time to leave the floor at shift change. The day nurse walks in onto the unit, chipper and full of life. You know she's going to ask you to report on your patient, and you need to provide a concise yet complete account. Hey, I'm taking over your patient in bed 20. What do I need to know?
Let's see, this is TD. He came in early today from surgery. He's fine, vital signs are stable. The rest is probably in the chart. Have a good shift. Going to bed.
Oh, okay, bye.
According to Shube and Balderrama, the desired outcome of the patient handoff is for all relevant patient care information to be effectively transferred to the assigned nurse to promote the continuity of patient care. Handoff report should communicate time, accurate information about your patient's care plan, treatment, test results, and condition, including any recent or anticipated changes in health or mental status.
Live, damn it! Live! Oh, I'm sorry, I didn't see you there. So, was that a good report, do you think? I'll tell you what, it wasn't. It was way too vague, there was not nearly enough information, and how is anybody supposed to know what to do if there's no communication? Let me show you some Karna competencies, alright? So, another competency that Karna has is this. This is what it says. It demonstrates responsibility in completing assigned work and communicates about work completed and not completed. So the RN is responsible for stating what was done and what wasn't done. Let's try that again, shall we?
Good morning, Bessie. Brought you a donut. How was the night shift? I'm so excited to be here. I slept like a baby.
Oh my gosh.
Who's your patient in bed 20? I'm taking over.
That idiot made me rage quit so much.
Oh my gosh.
It's like he was trying to die.
Ugh, I hate when they do that.
I mean, he's got a history of drug use, so like,
Of course.
what's even the point of me taking care of him? Obviously, my time could be spent better swearing. And he had abdominal pain for like a week before he even bothered coming into the ER.
What an idiot.
And he was also, from what I was told, a frequent flyer.
Oh, yeah.
And then he was Narcan twice last year.
What's the point, right? All right. Have a great night, day.
This example was completely unprofessional. This is not a therapy session, people. It is so unethical to be speaking about a patient in those terms at any point in time.
Hey, I have bed 20 now. What's the deal with him?
Good. Where's 20? Where's 20? Okay, so TD is a 58-year-old male who had surgery. Oh, wait, sorry, no, backtrack. He's 50, 19, 50, 60, he's 55. Okay. He came to the ER yesterday evening, night, maybe like 8-ish p.m. Okay, so he was complaining of abdominal pain. It was epigastric. Wait, and what's the... not the lower one, and hadn't had a bowel movement, and like, wait, did I mention that it was cramping pain? It was cramping pain. Okay, so he, it was afternoon, yesterday afternoon, sorry, okay, yeah, my bad. He went to the ER yesterday, the surgery was today. Did I mention the cramping pain?
Yes.
Yeah, oh, and his wife came with him. She has a lot of questions. He's post-surgery. The abdominal pain was an obstruction. That's probably good to know.
And anything else?
That's it.
So,
Okay, that was bad. I should probably figure out a better system.
how am I supposed to know what got done or didn't get done if she doesn't communicate it to me? How do you know what to say? One system is the 5 Ps: patient, plan, purpose, problems, and precautions.
Hey, good morning. I'm Catherine. I'm taking over your patient load. Can you tell me about bed 20?
Yeah, for sure. So this is Mr. TD. He's a 55-year-old male, and his code status is R1. He came into the ER yesterday with cramping, abdominal pain, nausea, vomiting, and some loss of appetite.
Okay.
He also stated that he hadn't had a bowel movement in over a week. So our plan for the moment kind of includes that CT scan revealed a bowel obstruction, and we had surgery already. He returned early this morning.
Do you know about what time?
About 3:20.
Okay, thank you.
He currently has an IV in his right hand and is running normal saline. Pain medications are scheduled in PRN. He's currently NPO and urinating into a urinal by his bedside. The dressing shows minimal shadowing, but it has already been traced, so you don't have to worry. And currently he's on Q4 vitals. He hasn't passed any gas yet, but he is able to get up without assistance.
Okay.
We hope he will be discharged once his bowel movements start to return. And we're trying to keep his pain under a 2 on the 0 to 10 scale. You'll also probably need to encourage him to ambulate, and he has already gone for 1 walk up to the nurse's station.
Awesome.
And we're also monitoring output, so just empty the urinal as needed.
Okay.
And we did notice that his blood pressure has been high, but relatively stable, around 150.
All right.
And he's not on any high blood pressure medication, so you'll probably have to phone the doctor if it continues.
Okay.
He has CDs on, or SCDs on. And while he has the incentive spirometer in his room, I didn't get the opportunity to teach him about it yet. So you'll probably have to do that on your shift. The NPO sign is above his bed, and he's currently in his room watching TV. Any questions?
Wait, sorry, you said the spirometer's already in his room?
Yeah, I haven't had a chance to put it together and show him how it works.
Okay, awesome. I can do that. All right, thanks so much.
Oh,
Have a great sleep.
Wait, he's also a little hard of hearing, so you have to go face to face.
Okay, good to know. All right,
Perfect, thank you.
have a good sleep.
So why is a good report for the oncoming shift so important? It's a part of several of Karna's entry to practice competencies. Some of those include uses appropriate assessment tools and techniques in consultation with clients and the healthcare team, uses appropriate information and communicates technologies to support information synthesis, as well as uses anticipatory planning to guide an ongoing assessment of client health status and healthcare needs.